Go.
Okay, so I will be going over feedings and removing the NG tube. So first thing I'll do is I will I will check my orders. Then I'll gather my supplies. I'll head to my patient's room, identify them by name and date of birth. Then I will do a hand hygiene. And I'll go ahead and put on my gloves. I'll be explaining to them that I will be giving them their feeding. I'll be doing a bolus gravity feeding. All right, so with these feedings, you want to check the residual first. Okay, and if the residual is less than 250 mils, you can just go ahead and continue with the feeding. And you can also give it back to them. But if the residual is over 500 mils, or if it's over 250 mils two consecutive times in a row within the hour, then you stop the feedings. Okay, so their residual is less than 250, so I'll go ahead and do their feeding. I would shake my milk or whatever you're using. I draw it up in the tube, however much. Well, first, actually, before I do that, I'll flush the tubing with 30 mils of water. Then I'll go ahead and drop my feeding, however much is ordered. Well, since it's a gravity feeding, you would just pour the milk into here. Well, this would be connected. You would pour the milk into here, and you'll be fed by gravity. So the higher you go up, the faster it goes in. The lower you are, the slower it goes in. When that gravity feeding is over, I would have some water also, and I would pour it in. And I can flush it either that way by gravity, or I can take this out, clamp it, put some water, drop some water in my tube, and then flush it with 30 mils slowly. Okay, and so if I were doing a feeding with like a bag and like a pump, then I would just like intermittently check the residual, make sure the feedings were set to the right rate. Yeah. Okay, and then yeah, so with this feeding, I'm done. I did gravity feeding. Okay, so now I'm gonna be going over removing NG tube. So I'll just go straight into it. So when you want to remove the NG tube, you want to, of course, verify your orders, gather your supplies, whatever you may need. When you go to your patient's room, identify them by name and date of birth. And I guess you can place, well, since it's already here, but you'll place like the towel under them or a blue pad, whatever you have. You would ask them to hold their breath, and of course, you explain what you were doing, and then you would just remove the tubing. If you remove the tubing, of course, you would throw away biohazard. You would perform nostril care, make sure everything looks good, make sure there's no swelling or anything strange going on there. And then you would just document what you did, the procedure, the time you removed it, how the patient tolerated it, and yeah.